With gastroesophageal reflux disease, or GERD, acid in foods splash up into the esophagus repeatedly. It's possible for stomach acid to damage some of the cells in the tissue of the esophagus. Sometimes the damaged cells turn into another type of cell. This process is called metaplasia. When metaplasia occurs in the esophagus, this condition is called Barrett's esophagus. When this happens, the normally smooth tiles of the esophagus lining look more like shag carpeting. When the change extends no farther than 3 centimeters, or about an inch up the esophagus, it's called short-segment Barrett's esophagus. When it extends farther up, it's called long-segment Barrett's esophagus. The cells involved in Barrett's esophagus are not cancerous when they first appear, but over time, they might
condition that affects the bottom of the gullet or esophagus. It's a change in the lining of the esophagus from the normal pale colour or skin-like lining to a salmon pink lining. And essentially the cells are replaced by cells that are very typical of the cells in the stomach or intestine and differ from the cells lining the esophagus. The most important aspect of Barrett's esophagus is that in some people, a minority of those with Barrett's, there's an increased risk of esophageal cancer. Barrett's esophagus do have an increased risk of esophageal cancer, and therefore it's good practice for those patients to undergo surveillance. Surveillance is undertaken by endoscopy, which is a telescopic examination of the esophagus. The procedure usually takes about 10 minutes and involves careful inspection of the lining of the esophagus. Now, the frequency at which surveillance should be undertaken, i.e. how often, should be between 2 and 4 years. Now, this is dependent upon the length of the Barrett's esophagus and also the type of cells within the esophagus. Occasionally, where the cells have started to change, we might suggest more frequent surveillance of perhaps every 3 months until we are sure that surveillance can be reduced.
On the day of the test, you should not eat or drink for 6 hours beforehand. Just before the test, your doctor will spray the back of your throat to numb it, or give you a sedative which will make you forget having the test. A nurse puts a mouthguard into your mouth, then they put a flexible tube called an endoscope into your mouth and down your throat. This is uncomfortable and may make you gag. Concentrating on slow, deep breathing helps. On the end of the tube is a light and a camera. This sends pictures to a monitor. It also has a tool that can take samples of tissue. Looking at the monitor, they examine your food pipe and then your stomach. If they see any abnormal areas, they will take a tissue sample called a biopsy. You won't feel any pain and you will be able to breathe normally throughout. Afterwards, you need to rest for a while. Your throat may be sore